Thanks a lot, Dr. Harsha and the organizing team for having me in this prestigious forum. And I'm really excited. It's a unique experience for me because it's 2 a.m., but you're saying, but I'm still thrilled. And I got a lot of insights from some previous talks. So I think I'm supposed to share my presentation. Okay. Yeah, is it?
Yeah, we can see your screen.
Uh, but is it in the presentation mode? Is it?
Yes, now it is.
Okay. So I'm Amlin. I'm a scientist and a pediatrician. I work at ICMR and I coordinate the National Registry of Rare and Other Inherited Disorders. So this is my bio. Yeah, so as I would phrase it, the rare disease research scenario in India is taking its baby steps, as I could understand from listening to the previous speakers. And rephrasing it from hinging it onto a previous speaker, we are just scratching the surface. So, as everyone is aware, there are about 7,000 to 8,000 rare diseases described. However, there is no prevalence-based definition for rare diseases for Indian population. So, if we have an estimate of 6 to 7% population being affected, that would sum up to a huge number of 70 to 76 million individuals, which makes it a big public health problem. Unfortunately, the heterogeneity of etiology and presentation, and coupled with lack of awareness among patients, families, as well as clinicians, uh, has been detrimental for the research scenario for rare diseases in India. So the awareness about rare diseases, as Dr. Kabra also put up, it arose after the patient advocacy groups presented their case to the government, and as a result, the rare disease policy of India was first released in 2017 and has since been revised once in 2021. So while the policy was being formulated, it was observed that it was a challenge to form a policy with no research backing. So side by side, while the rare disease policy was being framed, it was realized that nationally representative data and a registry on the national level was required. So, the National Registry of Rare and Other Inherited Disorders took shape in 2019, and it's a general registry for selected rare disorders, which also, as told by Dr. Cabra, was based on availability of treatment and relatively common occurrence. So it's selective, but not limited to a single disorder, as we heard from our previous speakers. We plan to expand the representativeness of the registry more to more disorders and more geographical areas. And this registry is a prospective and hospital-based registry. And ICMR floated letters of intent from researchers all over the country, and we received letters of intent, and the institutes reporting to the registry were selected based on the presence of expertise and diagnostic facilities in these centers. So as of now, 21 centers all over India are reporting to the registry. So this is a map of India. You can visualize the regions from where the patients are being enrolled into the registry. So this is the map showing 21 centers, and they represent the 10 states which are a part of the registry. Apart from among the participating centers, these 7 nodal centers were identified, and they were entrusted with more responsibilities, including quality assurance and hand-holding other participant sites. So the purpose of the registry is to identify the burden of the rare diseases, to integrate their care with the available and upcoming national health programs and policies to attain health for all, to collect phenotypic and demographic data from the country on rare diseases, as I was informed that the diversity in rare diseases is a real issue. Then to identify natural history of diseases with and without treatment, and then to support research on disease pathways and clinical trials on therapeutics and diagnostics. Then to connect the patients with clinicians, NGOs, patient advocacy groups, and researchers, and to integrate and link them with the national programs. Broadly, these groups of diseases are being reported in the rare disease registry. These are storage disorders, LSDs and GSDs, small molecule IMs, hematological disorders. Some of these are not even classified as rare disorders because of their common occurrence, but still it was thought that their national representation is required. So some disorders like thalassemia and sickle cell anemia are also part of this registry. Then there are skeletal dysplasias, primary immune deficiencies, neuromuscular disorders. So this is a screenshot from the web portal of the Rare Disease Registry. Currently, it is inward facing. It is visible to ICMR Central Coordinating Unit, and different interfaces available for the reporting centers. So you can see that the data on the cumulative data and the completeness of the data, and as well as the granular data of different diseases which form a part of this registry is displayed here. And on the left black strip, more features are available, like the quality control dashboard, monthly data. Then we brought an innovative way of prevalence calculation through a weekly prevalence calculator, which was a very rough to get a very rough idea of prevalence based on the hospital-based denominators. But we are probably now moving over it, and we'll try to find more ways of prevalence calculation. Then the diagnostic facilities at one center are displayed and available to the other centers also, so that because ours is a resource limited setting, so even if a diagnostic facility is present at one center, other centers can make use of that facility to get their patients tested free of cost in that facility. Then we can easily export records from here for quality assurance purposes and all. This is how the data flow works. The participating centers, they are data entry operators who enter the data. They are they check it for the quality and completeness. Then the nodal administrators, the nodal centers do the quality check. And finally, the master database at ICMR is there, which we have the rights for editing, data deletion, and final upload into the master database. This is how the quality control works, and the data entry on the web portal by all the sites is there, and there are checks within the forms, and then the checks by site PIs. Again, the nodal centers, according to the disorders they are leading in, they check the quality, and the quality checked forms are again visible to the feedback is given to the participating centers. They do the corrections, and then monthly reports are sent to them, and the quality cycle goes on. There's for the technical oversight, there's a technical advisory group. They're comprising of geneticists, neonatologists, pediatricians, public health experts, and there is one representative from the Ministry of Health. The tag has purposely been constituted heterogeneously to represent the multi-speciality collaboration needs of rare disorders. The salient features of the data are the total number of enrollments on the day I made the slide was 10,985, and I'm happy to inform that we crossed 11,000 yesterday. And the total rare disorders that are identified under the registry at present are 160, and there are 28 states of the country and 8 union territories are represented in the registry. The topmost categories of the rare disorders reported are neuromuscular disorders, storage disorders, followed by thalassemia. This is another map of India depicting the state-wise distribution of patients enrolled in the registry according to their residential address. And you can see that states of Karnataka, Uttar Pradesh, Tamil Nadu, Maharashtra, and Assam are leading. And but this information can be taken with a pinch of salt because as you know that it's not a community based registry, it's a hospital based data, so the nature of data is affected by the nature of the institute reporting. So we have nimhans at Karnataka, which is primarily institute which reports on neurological disorders, and uh, clearly neuromuscular disorders are the biggest feed into the registries. So that's how Karnataka tops the charts. It does not mean that Karnataka has maximum number of rare disorders. So this is pie chart. It shows that neuromuscular disorders, mainly comprising of Duchenne muscular dystrophy and spinal muscular atrophy, form the maximum major chunk of the disorders reported under the registry. It is followed by thalassemia and then storage disorders, followed by IEMs. So, and this was an overview of the registry. So, how the registry can be useful. I'm talking in future tense because even though the registry was started in 2019, we had to do a lot of work on from the scratch, making the data forms and making the software from the scratch, and a lot of background work was there. So the main data collection was initiated last year only, and till now we have reached 11,000, and we are in the process of quality assurance. And so I think it's the data that is being collected is soon going to be helpful. So I'll be talking in future tense here. So it's a powerful tool to describe the spectrum of rare diseases, and with an understanding of disease progression, treatment options, disease outcomes, and all of this relating to the socio-demographics of the patients. Um, it's not working. It's like, okay. So the access to this data can be a key for the policymakers, clinicians, researchers, patients, and NGOs together. The registry can be a monitoring tool and a surveillance tool for the delivery of healthcare to the patients across the nation. It can also be useful in determining if the healthcare services provided are compliant with the government guidelines and recommendations. And it makes a platform that makes it easier to do further research, clinical trials more efficiently and effectively, especially in the light that ICMR consortium is also coming up side by side, which is going to deal in therapeutic and diagnostic trials as well. It can be instrumental in development of newer technologies, therapies that can be beneficial to those affected with rare diseases and the community. So, describing some challenges that we are facing and we have faced while developing this registry. Estimating the burden of the rare diseases is still a challenge that we are facing because it is a hospital-based and not a community-based registry. So finding that denominator to work on to find prevalence is still a challenge. For this, we are trying to make the registry more representative by adding more geographical regions and more diseases. And alternatives that are being thought of are like genetic analysis of the carrier of the traits uh, with the non-trait as a denominator, but nothing has been finalized. So we are still working on it. Then the prioritizing information needed, especially in our resource limited settings, to get to know what is really required. And so the experts at nodal centers, together with the tag members and ICMR, we have worked really hard on developing these case forms of the rare disorders to identify the most important data to be collected, then developing the software support from scratch, including designing data elements for each disease and forming a database structure and providing regular IT support to all the 21 centers has been a real challenge for us. Then assuring the quality of data. For this, we worked really hard to develop these forms with mandatory fields built in, then allowable ranges for the quantitative parameters, checkbox type selection, checks to avoid data in multiple formats, then quality check by the nodal centers, and display of incomplete forms to site, and monthly feedbacks being sent to all the sites. There are more challenges like keeping all the sites motivated with like limited incentives in our limited settings. They have busy clinicians and they have to balance between patient care and reporting to the registry. Then, to avoid duplication of entries, we have identified some identifiers like Aadhaar card, which is a unique identification of all citizens in India. Then, mobile numbers are also used as identifiers. And improving representativeness, we are working on this. And then forming linkages between the government funding portal, the Center of Excellence identified by the Government of India, and the registry. Then another challenge that we're working on is forming a network of patients, clinicians, researchers, NGOs to form a unified voice for the rare disease patients. So the way forward for our registry is definitely increasing more awareness and utilization of the data. And how we are going to do that, we are planning on increasing visibility of the registry by forming a dashboard and a web portal for the registry, which will be visible to the common public, to the clinicians, to researchers, to the government. And then increasing representativeness by adding more geographical regions and more diseases into the registry. And definitely, we have to think about the sustainability, because the models which exist in some other countries, like public-private collaborations and support from various organizations and patient support groups to retain the registry. They're not currently, going on in India. It is currently only ICMR funded and supported. So definitely, we need to find a way to sustain the registry too, because this data is very important and it must go on. So thanks a lot. The sessions have been really, really informative and insightful for me, and we wish that we are able to do much more and develop more collaborations and bring out a unified voice for Indian rare disease patients. Thanks a lot.